Hello, everyone, friends, scholars, colleagues, Dr. Riley. This is Group 1, consisting of Miles Turner, Sydney Bates, Hallie Mooring, Hani Rivera, and Brendan Ertle, giving you a great breakdown of Topic 2, Pain, Anxiety, and Dental Fear in Children. This is a presentation based upon our own research and firsthand experiences from dental experts. Without further ado, here's Hani Rivera.
Hello. The origin of dental fear and dental anxiety is complex and believed to be caused by a combination of different factors. Studies have shown that dental anxiety affects 40 to 50% of children, making this a common issue encountered by general and pediatric dentists. Some children even avoid the dentist unless the pain becomes unbearable and the visit is completely necessary, which can in turn cause for simple procedures to become complex and making their visit unpleasant. But what exactly do they fear? Pain would be the number one thing. If they have never been to a dentist, for example, they might have heard from parents or peers painful experiences. Fear can even come from a parent's attempt to comfort them with comments such as, it won't hurt, because it may cause them to wonder if they should expect pain. While being at a dental chair, different sensations may be confused or associated with pain without them really being painful. Examples are reaction to cold, hot, pressure, or simply the touch of the metal instruments. The fear and anxiety may also be triggered when the dentist explains, hold on, where there may be possible discomfort before an injection. That anticipation of pain may cause distress. Some kids may fear the unknown aspect involved in a visit to a dentist. Not knowing what to expect, the introduction to new equipment and tools very different from anything they might have been exposed to before. Dentistry is also invasive and involves the dentist having to work in someone's personal space, which some may be more sensitive to than others, and this may in turn cause for them to feel uncomfortable, making it overall a negative experience regardless of the procedure. Another issue may be the idea of a stranger being so close. Others may have had previous experiences with dentists in which they felt the dentist ignore their pain and may already cause the anxiety when having to return to a dental setting. Some possible contributing factors may include children's past dental experiences. Those will determine a child's behavior and attitude in a new dental appointment. Things the child may remember from previous visits, such as smells, strong taste, if the discomfort was bearable, they will likely carry with them to future dental visits. Also, how do their parents or closer relatives feel about the dentist themselves? Because any comment, whether negative or positive, in front of a child may have a direct effect on the child's reaction to the dentist. Another thing that plays an important role is how the child is welcomed. How friendly is the staff? Are they constantly smiling and comforting the patient during the procedures? Are they giving clear instructions to follow? In general, a child's fear and anxiety may be determined by their perception of everything that's involved in a dental office, which can change from person to person. Some challenges in general that dentists face and must take into consideration in order to reduce anxiety and fear are the following. First, trying to earn the patient's trust. They must also search for methods in which to better communicate with the child, such as using a teacher-student approach, for example. A dentist must pay close attention to emotional and physical indicators of stress and avoid becoming unresponsive to someone's discomfort. A dentist must assess each child's developmental level as well as their attitude and temperament to come up with an effective treatment approach.
Okay, this is Hallie, and I helped with the research component and finding some outside research to relate to our topic. And a cool research study that I found was actually done really recently, last year, and it kind of measured the effectiveness of waiting room distractions with children before like basically a root canal on a mandibular first molar. And so there are about 70 kids involved. So basically, there was a control group, which was half of them, and they had no distractions while in the waiting room. And then the other group, the experimental group, was the VR group because they had virtual reality glasses to watch cartoons for at least 20 minutes while in the waiting room before the procedure. And did it work? And the study showed yes, it did. The VR group had significantly lower modified Yale preoperative anxiety scales, heart pulse rates, and the Wong-Baker face scale that all measure anxiety. And in the control group, the scores were significantly higher. So the anxiety scales were higher in the dental clinic compared to the waiting room. But in the virtual reality group, there was not a significant difference in the scores, which meant that it didn't spike once they got to the clinic from the waiting room. So what does this tell us? It does tell us that distraction techniques in the waiting room may help relieve dental anxiety for children in clinical practice, and that the dental environment and the office environment can impact dental fear and anxiety for children. What doesn't this tell us, though, is that if it works for routine cleanings or other procedures, because the procedure that was done on these children in the study was a pretty invasive procedure. So though something more simple, maybe the results actually wouldn't be as significant. It also doesn't tell us if it directly or indirectly affects behavior as well, because that wasn't really addressed, just kind of the anxiety scale. So if that anxiety or perception led to behavior issues, we don't know much about that. And it also doesn't really tell us if it has longer lasting effects on their children's decreasing the anxiety levels for these children for future appointments, so that maybe they won't need virtual reality glasses or some type of distraction. We don't know maybe if that cured it for everything, or if it was just a one-time thing. But it is important to realize that comfort and a lot of things that go into kids being afraid of the dentist is what leads up to it, and how they are treated and what kind of goes on once they step foot in the dental office, no matter what.
All right. Hi, this is Miles. And the first dentist that we interviewed was Dr. Deborah Mendel, and she's a general dentist at the Ohio State University Faculty Clinic. And before working in the faculty clinic, she spent 13 years in private practice. So she has experience in a wide variety of clinical settings. And she actually believes that pain-free dentistry is possible. However, dentistry without discomfort is not possible. So in her experience, she sees about 5% of patients show some signs of discomfort. And the biggest reason she finds this number is so low is because her patient base has parents who've had good oral health habits. And then they've also passed those oral health habits on to their children, and they haven't had as many invasive procedures done. But for those who do experience either discomfort or some sort of anxiety in the clinic, the parents' experience with previous dentists and how they imprint on their children plays a huge role. One example that she shared with us was of an 8-year-old child who came into the clinic and was hysterically crying before anything had even been done. And the child had no history of dental issues, but her mom had a root canal done recently. And she assumed that when she was coming into the clinic, she was having a root canal done as well. And she was actually just coming in for a new patient exam. So this is, again, an example of how the patients play an enormous role in this process. And then as far as measuring discomfort and anxiety, Dr. Mendel has seen a few consistent verbal and nonverbal cues. As far as discomfort is concerned, for those, the common verbal cues are crying upon an injection and wincing when touching a sensitive area. And on the other hand, the nonverbal cues would be full body tensing or gripping the arms of the chair when they're in the clinical setting. And then as far as anxiety is concerned, the most common verbal cues for anxiety are spontaneous crying in the absence of any stimuli, just like the 8-year-old patient example. And the nonverbal cues would be fidgeting and thrashing in the chair before the procedure has even begun. Now, in cases where a patient is experiencing some level of discomfort, Dr. Mendel believes the best way to minimize that discomfort is first to tell them when the pain should be anticipated. So she's found that patients who understand some discomfort is coming usually report less severe discomfort than those who've been completely caught off guard. And then furthermore, she minimizes discomfort in different ways for different age groups. So she's found that with younger patients, making the experience a fun one is a huge way to minimize discomfort. So she'll do this by naming the instruments. For example, the suction is Mr. Thirsty and the drill is Mr. Whistle. And another way that she makes the experience fun is by turning it overall into a game. So usually she'll do this simply by just asking the kids to count their teeth as she counts her own. And then finally, she'll emphasize the tell, show, do approach, especially with the younger group in very simple terms so that everyone's aware of what's going on. This ends up being a little bit different than for the 9 to 12-year-olds who want to be treated more like adults than little kids. So she'll give a much more mature explanation of the procedure itself or the process is being done. And with this age group, the kids are more likely to understand and comprehend what's being done, why it's being done, and most importantly, that what's being done is being done to help solve a problem. So ultimately, treatment like this will build trust with the patient and help minimize the discomfort they experience during the procedure. And then as far as anxiety is concerned, Dr. Mendel believes the best way to minimize the levels of anxiety in a patient are to be the first person the patient comes into contact with. So she actually believes this so much that she'll do the first 2 to 3 cleanings on every new patient. And she's done this in both the private practice setting and then currently in the faculty clinic, and found it's had an enormous impact on children in creating a great first impression of going to the dentist and keeping those numbers of anxiety and discomfort relatively low. Second, she believes it's very important when you have an anxious patient coming into the clinic that you read the patient as well as the patient's parents when they're walking into the room. So this would be recognizing the signs of anxiety we spoke about earlier and making sure that you're the first person they encounter on their way to the exam room. Then additionally, to decrease that anxiety, a detailed explanation of why you're here today and what's being done will help ease overall anxiety. And importantly, you must assure them that whatever discomfort they may be having or the anxiety they may be having will go away when the procedure is over. All the while, it's important to remain a calm and solid presence in the exam room that the patient can be confident in. And actually, in some cases, it's the parents who are causing the anxiety. So in those cases where the parents are actually increasing the child's state of anxiety, she'll first ask the parent to step outside of the room and talk to them in private, explain maybe an alternative or a more appropriate way of acting in the room to help the procedure run a little more smoothly. Then if the parent isn't complying and it would benefit the child not to have the parent in the room, she'll politely ask them to leave until the visit is over. So these are the experiences in dealing with discomfort and anxiety in a general dentist with her pediatric patients.
Hello, this is Sydney. I interviewed Dr. Beth Keels with Growing Healthy Smiles Pediatric Dentistry. Dr. Keels does not believe that pain-free dentistry is possible. She notes the pain that the patient would feel during an injection of local anesthesia, but also during recovery, so after the actual procedure itself. But she does believe that we can make it as comfortable as possible for the patient, and that's what you would strive for in the office. About 20% of her patients experience pain during a visit. About 2% of procedures that don't require local anesthesia, patients actually have pain, whereas procedures that do require local anesthesia, the more invasive procedures, she finds about 90% of her patients do feel pain. But she does note that there are many other factors that are involved in what goes into dental anxiety for her patients. And so there's so many other stimuli within the office that can really stress the patient out. Things like pressure, sound, touch, and taste. Dr. Keels measures pain through verbal communication and nonverbal communication, much like Dr. Mendel. She often finds that the nonverbal communication is even more important than the verbal communication. She finds that a lot of times there are kids who try to be strong, try to not look like they're scared or in pain. And so she has to be very acute when she is working on them and making sure to watch their eyes, see if their body's tense or if they're holding their breath. She compares that with anxiety, where patients, instead of having those kinds of physical reactions, a lot of it happens right before the procedure. She says that kids who have a lot of anxiety, they ask a lot of questions, they try to stall the procedure, they try to distract, and a lot of times she'll see crying prior to the appointment or prior to even touching them or even starting the procedure. And for Dr. Keels, she believes that we should always talk about pain with the patient. She says the worst thing that we can do is catch the patient off guard. That immediately ruins the trust between the patient and the dental office. She'll use different terminology based on age. So for the younger patients, she'll use sleepy drops. For older, numbing drops, raincoat versus rubber dam, lightsaber versus curing light. Mr. Thirsty has a section. She will depend, it kind of depends on the child. She said that sometimes she'll have like a 7 or 8 year old who, you know, is kind of well beyond their years, more mature. And so she'll talk about the sleepy drops, and she'll say, oh, you know, these are sleepy drops, but the actual name is, you know, lidocaine, and she'll show them the carpule. And it just kind of keeps the patient a little more stimulated, and they appreciate her recognizing that, you know, that they don't need to just be sleepy drops for them. Two major factors that go into her patients being afraid for their appointment is fear of something hurting and fear of the unknown. About 50% of those patients are afraid when they arrive for the visit. But I feel like the most important thing of all that she harped on was that you must establish trust. The behavioral management techniques that Dr. Kales uses, tell, show, do, she says that this is the gold standard for the way that she treats patients with dental anxiety. She always makes sure to give them time to, you know, show them exactly what she's doing, what she's using, and make them feel as comfortable as possible. She also uses a lot of familiarization techniques, so euphemisms like in the last slide, the, you know, lightsaber versus the curing light, something like that. She will also use desensitization. So she'll, you know, have the parents show the child photos of her office on her website, and then she'll have them come in and meet the staff, and then maybe come in and do a cleaning, and then finally get to the actual treatment. But just really taking enough time to be able to, for the child to feel comfortable in that environment and not be so afraid and overstimulated by everything going on. If possible, she will try to keep the same dental provider and assistant. In her office, there are 3 dentists and then a number of different assistants. So she tries to keep the children with the same dental provider. Again, just building that comfort, building that rapport. She'll also normally allow the parent to be in the room. She rarely ever asks them to leave the room. Occasionally she will step out of the room and talk with the parent. And actually a lot of parents will just know that their child does better on their own. And then they'll just leave the room themselves. But she also really enforces positive body language, voice control, using very mellow voice, distraction. She has TVs in all of her operatories, and then really allows the patient to have a sense of control. So she'll let them hold the different tools and, like, you know, play with the suction and just make them feel like they have a bit of control over the situation. They also have a reward system. They have tokens that they'll give them. And then one other thing that, you know, she really talked about was just physical touch. Like, whenever they feel potentially really stressed or a lot of anxiety, she'll just put her hand on their shoulder, and that's little thing can just be so calming for a child.
All right, guys, this is Brennan for our 3rd dentist speaking on the topic, and his name is Dr. Joseph Bolter. He has a practice in Jacksonville, and he believes that pain-free dentistry is possible, contrary to Dr. Kale's beliefs, but I believe there's some sort of semantics differences there, and we'll go into those in a little bit. And like I said, there is some semantics differences there. So he believes there will be some mild discomfort, especially when you're administering some anesthesia, but there should never be a real pain present, especially in children. And when he performs his procedures on children, only about 5 to 10% of them may end up rescheduling, and he wants to make sure that children are there to do it when they are ready. And that's very important to him, because whatever foundation you lay for the children now can be built upon throughout the rest of their visits at his practice. So Dr. Joseph Bolter, during our interview, we asked him, how do you measure pain? How can you tell what's going on with your patients if there's anything going on? And he said one of the first things he does is he says, hey, if you feel any discomfort, if you feel anything that's not right, if it should be a painless process, just raise your hand. And having that clear way of communication is very important and it's vital to the procedure. Also, one way you can tell if a patient's trying to tough through it, and he says it's a surefire way, is the tears in their eyes. He says you can't really fake that. And then we asked him about, well, how do you measure anxiety? And he says that's so much more subjective. He said, so you kind of have to use your visual cues, kind of go off the person's baseline. Whenever they walk into the waiting room, how are they acting? You know, you kind of see them come back. Do they seem uncomfortable? Do they seem unsure? Because these are the things that you're going to have to follow through to gauge these different things and then decide, like we previously talked about, if you do need to reschedule the child. So Dr. Bolter has three major keys. So you need to remove pain from the conversation. You need to communicate exhaustively. And then no patient should be afraid when they're arriving in the office. So the first one is removing pain from the conversation. So Dr. Bolter doesn't even use the word pain. Okay, he removes it completely from the vocabulary in his practice. And by doing this, this will kind of keep the association of pain and dentistry away from the patient. And he believes this is very important. And he will use other words such as discomfort, because if there is anything going on, he doesn't want to have this associated negatively with him, his practice, and wants the patients to continue to have great experiences. So adding to that, you know, to prevent certain things, the patients may ask questions, and he wants the patients to continue to ask questions, which gives them, as he said, the perception that they are in control, which in reality, the dentist is in control of the procedure, but having the patient being able to ask questions and get answers and control the conversation allows them to feel more in charge and like that they're in charge of the procedure. So by going over a brief interview of the procedure, making sure they're not surprised by anything that's going on, this helps the patient also feel more at ease. So the third thing we're going to talk about is making sure the patient isn't afraid when arriving in the office. So this kind of ties into other things. You know, what's their past experiences like? What's gone on? Did you communicate effectively? So all of these things should be put to rest. You know, brochures that are being handed out, communication on what the procedure is going to be done before they arrive. And Dr. Bolger, we said, does he have any patients? You know, we asked him, does he have any patients that arrive afraid? And he said no. He says the only ones that would be afraid are ones that are coming from outside offices with past traumas and they're looking for a new dentist. And he works with them diligently to accommodate them to make sure that their experience continues to be a good one at his practice. So depending upon different strategies, we asked upon Dr. Bolter about, you know, how other dentists do things. We said, what about tell, show, do? He said, that's a great idea. He said, however, I would never show the needle because some people are just afraid of that at the site. So things, you know, that he would show and do and you know, talk about are things that would reduce anxiety and things that would, you know, put the patient more at ease versus showing a needle, which may increase anxiety. You know, like we said earlier as well, we're going to give an overview of the procedure, and various other dentists in this, you know, presentation have also talked about how you go into varying detail with age group. And then you also want to create a calming presence. So that starts as soon as the patient comes in, as soon as they sit down, and you as a dentist are going to be very responsible for that, because whatever you talk, whatever tonality you use, the confidence that you portray, that is, you know, communicated indirectly to the patient, and they can understand that. One of the most important things Dr. Bolger said is a comforting touch. A hand on the shoulder can go a very long way, reassuring them that you're there, that you care about them. Another great thing is to distract them. And a lot of offices, you'll see this, is, you know, they have TVs, music, games going on, something to take their mind off of it. And Hallie mentioned it with the VR headset, kind of using that as a way to distract. Another thing he recommended is if there's any pain or anxiety that people are really worried about, he says nitrous oxide, it can really go a long way and be extremely effective. He said almost all parents support it, and it's very easy to use.
As for the similarities and differences, most of the dentists had pretty similar points of view. However, I do think the differences in the pain-free dentistry where the two general dentists believed that pain-free dentistry was possible and the pediatric dentist did not. I do agree with Brendan that it might be a bit of semantics, but I think for all of them, they understand that it can be managed. Yes, there's going to be discomfort, but it can all be managed. Also about talking about pain with the patient, Dr. Bolter does not want the word pain to ever come out of someone's mouth. He doesn't want that to enter the realm of possibility for the patient. So he really tries to keep that away. But in terms of always just keeping an open communication, understanding the type of patient that you're treating, an older child versus a younger, being able to measure the difference between a patient who's actually in pain or in distress, and using physical touch, comforting the patient, and really just building trust. That is the most important part of treating children.
So that goes into the most important thing that we believe is important for clinical practice, and that is building trust. All three of the dentists have established that is a major factor, because you have these young children, especially in their twos and 2 to 4, where they're in that in that clingy stage to their parents, and they need to be able to trust you, and that will be extrapolated upon their experience throughout your practice. And the next thing that they all touched upon is communication's key. A lot of them will use brochures, things beforehand, talk to the parents, make sure that the child isn't surprised. And then, we talked about semantics as well, and that discomfort may be expected, but pain should not really be there unless it's during the recovery phase. And then, depending upon anxiety as well and what child's, fears are, parents do play a large role. So by using them as a tool and not something that holds the child back is very important as well. And then we have our references here and our individual contributions.